How are you, my people? This is Samuel Sane from Kenya. I am here at GlenEagles Hospital, Mumbai, and I have a friend I met at GlenEagles Hospital, a special doctor, Dr. Tushar Jadhav.
Yeah.
Doctor, kindly say hi to.
Yeah. Hello, everyone. Myself, Dr. Tushar Jadhav. I'm Surgical Oncology at GlenEagles Hospital, Mumbai.
Wow. Doctor, what do you do here at GlenEagles?
Yeah, we are doing great here. So there is a lot of patient pool, and we have a long operating lists for the cancer surgery department.
Surgery department.
Yes. So as far as the department is considered, we are doing all kind of surgical oncology and reconstruction work. So we have a vertical specialties like organ-specific specialties like head neck cancer surgery, breast cancer surgery. We have a thoracic department for the lung and esophagus. We have a HPB department for liver, pancreas, and biliary system.
Yes.
Colorectal, gynae oncology, uro-oncology, bone and soft tissue oncology.
Yes.
So we have all the vertical specialties in the banner of cancer surgery department. Not only that, but we have a medical oncology department for the chemotherapy, immunotherapy, targeted therapy, and the radiation oncology department will start soon.
Good.
Yeah.
That's good news. Doctor, what do you specialize in this
I'm
department of oncology?
Yes, I'm specialized in head, neck, and breast surgical oncology.
Head, neck, and
breast and gynae oncology.
And gynae.
Plus onco-reconstructive surgeries. That at the same time of cancer surgery, we are doing a reconstructive surgery to give better quality of life, better functions, better looks.
Yes. So, what kind of cases that you have encountered in this oncology department?
The most common case in men is head neck cancer.
Head and neck.
Yes.
Okay.
There are multiple head and neck cancers, like even jaw cancer, tongue cancer, cheek cancer, even thyroid cancer, laryngeal cancer, that is voice box cancer. So these are common in men. And it is related to the addiction to tobacco. In women, the commonest is the breast cancer.
Breast cancer.
Yes. And the second commonest one is a cervical cancer, that is uterine cancer. So we are getting these kind of, yes, we are getting a lot of these cases. And rest, even the liver, pancreas, stomach, esophagus, lung, these are also common, but the commonest are the head, neck, as well as the breast and the gynae malignancies.
Yes. Now, how often do you do surgery work at this hospital?
It is daily. We have a daily surgeries, almost daily surgeries. Hardly once in a week it is not there.
Okay. Now, concerning the breast cancer, please talk about it in a little bit, because so many people in Kenya are suffering breast cancer and cervical cancer too.
Yes. See, the breast cancer and cervical cancer, these are two common cancers in women. Now, as far as the breast cancer is considered, actually it is not a preventable disease. We can't prevent that disease because as of now, we don't know what causes it. We don't know the causative factors, what is causing breast cancer. We don't know that. If we don't know what is causing that cancer, we can't prevent it. For example, in head neck, majority head neck cases are because of tobacco.
Yes.
So if we avoid tobacco and tobacco products, we can prevent that cancer. For example, if we avoid smoking, we can prevent lung cancer.
Yes.
That way, we don't know the causative factor of breast cancer. That's why we can't prevent it.
Yes.
Now, once we can't prevent, that means it is inevitable. It is going to happen, it is going to happen. Then it is in our hand to detect it early. As we are not going to prevent it, so what's in our hand is to diagnose early.
Yes.
If we diagnose the breast cancer early, then it is completely curable disease. Now there are a lot of advances in therapies, like in surgery or medical oncology therapies, that is chemotherapies. Because of those advances, even there is a limited spread in the body, still that cases are curable.
Yes.
That means this stage 1, 2, 3, and the last stage, which is having a limited spread, those cases are also curable. So breast cancer, one should not fear about.
Yes.
Even if it is diagnosed at any stage, there are treatments available which can cure you completely.
Yes.
Now, not only that, for the cure, we need surgery, we need chemotherapy, we need radiation therapy. All three pillars are important.
Yes.
Main is the surgery, because surgery is inevitable. We can't avoid surgery if it is curable. In some cases, there are few cases where we can avoid chemotherapy. In few cases, we can avoid radiation therapy, but surgery is important.
Yes.
Now, in surgery, there is a kind of thought that whenever there is a breast cancer, we have to remove entire breast. And it becomes that you can imagine a woman, when we tell her that we are going to remove your breast, it is a trauma to her womanhood, the psychology trauma.
Yes.
But now the advances in surgery in such a way that whatever the size of tumor is, however the big tumor is, however sometimes there are multiple tumors in a breast, whatever the situation is, we can conserve breast. We can conserve breast, we can remove the cancerous part, and we can even reconstruct that time. Because see, breast is a symmetrical organ. If it is a good shape and symmetry, it looks beautiful, and the feel of the womanhood is better whenever there is a good, beautiful breasts. So at the time of resection, whenever we are doing a partial or complete mastectomy, we can reconstruct that breast as it is. And for that reconstruction, there are multiple techniques available. That is various flaps or implant, without implant. There are a lot of techniques, and the technique depends upon this body structure, the requirement of the woman. All those can be clubbed in the cancer surgery. Now that's why the breast oncoplastic surgery is a new field where you can give the cancer surgery as well as the oncoplastic reconstruction at the same time.
Yes.
Now that gives you a better quality of life, because see, breast cancer is curable disease. You have a long life, you have a full life, so you need not to live that life without breast. So that gives a different perspectives to the woman.
For example, there is a patient who they did the mastectomy, they removed the whole breast. Can you reconstruct?
Yes, there are two ways of reconstruction. One, that is at the time of removal, we can do. That is a primary reconstruction.
Yes.
But many of the times what happens, what I'm seeing in the OPD, that many, like long back, like in 10 years back, the people were keen to just remove the breast whenever there is breast cancer. So many people are coming for the follow-up without breast, and they want that reconstructed. So that is called a secondary reconstruction. So that can be done at any point of time. So even that secondary reconstruction of mastectomy patients, we can do it at any time.
Good.
Yes.
That is good news to so
Yes.
many women who think
Yes.
Life is not good, life is
Yes.
not beautiful
Not
without
at all.
the breast.
Yes.
No, what about the uterus or
Okay. Now,
cervical cancer?
yes. See, the second most common is cervical cancer. Majorly, cervical cancers is because of the HPV, papillomavirus infection. Nowadays, the vaccine has come, HPV vaccine, which is given to a teenager, adults, and girls, so that prevents cervical cancer. And that's why whenever there is a vaccination, rampant vaccination, like in Indian territory, so we are seeing now less and less cervical cancers because the incidence is decreased because of type vaccine. But once it happens, still it is in stage 3 also, it is curable disease. In stage 1, stage 2, stage 3, all three are curable. Only stage 4 in cervical cancer, it is not curable because it has already spread. Then we have to just control the disease by way of chemotherapies or radiation therapy and alleviate the symptoms. But whenever there are symptoms like vaginal discharge, white discharge, or bleeding per vagina, or at the time of some intercourse there is a bleeding spots, so you should consult gynecologist. If there is some mass at the cervix, you have to take an immediate biopsy. Then we do some scans like MRI scan or PET CT scan to see how much is the spread there locally as well as in the body. And if it is localized spread, comes in stage 1, 2, or 3, it is still curable disease. Now again, for that cure, we need again surgery. We need chemotherapy. We need radiation therapy too.
Oh, that's great. What do you tell most of these cases of cervical cancer? What do you tell women about it?
So what I tell that do not neglect any kind of symptoms, because whenever we catch it early, we can cure it.
The earlier the better.
Earlier is the better. Earlier diagnosis, better diagnosis. Now again, cervical cancer is now preventable disease, unlike breast cancer. As told, breast cancer is not preventable because we don't know the cause. But we know the cervical cancer cause, that is a human papillomavirus. So we can prevent to a certain extent by vaccination and by hygiene, by maintaining the hygiene. So by these practices, we can prevent it. The hygiene, especially the sexual intercourse hygiene, as well as overall general hygiene, and the HPV vaccination. To some extent, we can prevent. But any symptoms should not be neglected. It should be caught early, and diagnosis should be early.
Women should avoid negligence.
Yes. And one more thing I wanted to emphasize, that organ preservation has come. Just like in breast cancer surgery, we can conserve breast. In the same fashion, if let's say there is a young patient, there are a lot of examples we have treated in this hospital. There are young patients like in 20s or 30s. They want their uterus because they want to complete their family, they want babies. And if they have a cervical cancer, then there are a protocol to conserve the uterus. That means that we can give chemotherapy and radiation therapy to cure the disease without surgery. And if the surgery is indicated, even we can preserve the uterus body. And we can remove the cervix by the way of radical trachelectomy. So that is the procedure where we remove entire the cancer part and we preserve the body and the vagina, so that that lady, after completion of the cancer therapy, she can be pregnant. So that organ preservation protocols has come, and we are rampantly discussed with the patient about their by understanding their will, their desires, their life, and what are the options available.
Good. Doctor, I've heard of a story. I don't know whether it is true or it's a myth about these contraceptive use. Do they affect or do they bring cancer?
The contraceptive pills do not usually bring the gynecological cancers, but actually these are some of the risk factors for the breast cancers. So it is said when you are on active contraception pill use, the risk of breast cancer is increased by 30 times.
30 times.
Yes, and if
Because
you
of
stop
the
it,
contraceptive
yes,
pills.
and if you stop that use, then the that effect remains around 12 to 15% for almost 10 years, and then 10 years it becomes nil. So it is better to use a barrier method of contraceptions than using the oral pills.
Repeat it again. Let them
It is
understand.
it is important to use a contraception, but the barrier method, mechanical method like the use of condoms, is better than using the chemical methods like oral contraceptives.
Ah,
Yeah.
they are risk factors.
Yes, and even the barrier method of contraception, like condoms, it will prevent even the HPV infection. So that HPV infection will be prevented, which is actually a part of hygienicity, and that's why even cervical cancer will be prevented.
Wow, that is good.
Yes.
Yeah, thank you, doctor.
Yeah.
What else do you have to tell our women and also our men who usually drink so much and also use of tobacco?
Yes.
Tell them.
See, the alcohol and tobacco are related to many cancers basically. As far as we talked about the cervical and breast cancer, but actually the alcohol and tobacco are not associated directly with breast cancers or cervical cancers. We have no proof yet because smokers are having more cervical cancers or breast cancer, or non-smokers are having less breast cancer or cervical cancer. We don't have that data yet, which can support it. But the alcohol and the tobacco use can cause many cancers. Like it is related to the oral cavity, upper airway, esophagus, lungs, urinary bladder, stomach. So these are associated with the abuse of alcohol and the tobacco. So it is better to avoid these kind of cancers.
Wow, that is good.
Yes.
To conclude this, doctor, what do you tell our young men and women who wish to be doctors like you?
Yes. See, first of all, you should be having a good lifestyle. That is regular exercise, maintenance of health, no addictions. By these techniques, we can prevent many cancers. But there are few cancers which are not preventable. In those cases, we should not neglect our health, or whatever the aberrations in your health, like whatever the symptoms or whatever the signs, please understand that and don't neglect it. And please consult the consultant at right time, so that earlier will be the diagnosis, minimum will be the treatment, and good quality of life with full life expectancy. That means it is completely curable with good quality of life with minimum treatment. If you actually neglect it, it go on increasing, stage go on increasing. Sometimes it will be incurable, sometimes it will be curable, but it takes many long treatment protocols, because because it is, if the higher stage, we need more and more treatments to cure. So the cost of the treatment also increases. So early diagnosis, short treatment, short money of expenditure, good quality of life, full life. So that's why early diagnosis is important.
Where did you go for your studies?
I studied my all surgical post graduation here in Mumbai University.
Mumbai.
Yes, the MCH cancer surgery is from the Calcutta and Tata Memorial Hospital here. And then because of my interest of fellowships, interest of oncoplastics reconstructions, that is head, neck and breast plastic reconstructions after cancer surgery, I have done many fellowships from Europe and Canada and USA. And then I started practice, and now 15 years in practice.
Wow, you've been in this field for 15 years.
Yes. In this institution, I am here for a year. But before that, I was in other institutions for almost like 13 years.
Wow, that is good.
Yeah.
Thank you so much, doctor.
Yes.
And we appreciate your efforts to give us time to educate our people back in Kenya and other areas.
Yes.
We hope soon you come to Kenya.
Yes, definitely.
Also, we'll send our patients who need your services here at GlenEagles. Thank you so much. God bless you.
Thank you so much. Thank you so much. Yeah.